Hi, my name is Blake. I'm going to be your nurse today. I'm going to wash my hands and provide some privacy for you. Could you please tell me your name and date of birth?
This is Vincent Wynn, 0604-1998.
Okay, Vincent. I'm going to be doing an assessment on you, so could you please tell me if you have any cultural or spiritual beliefs that might affect your care today?
No.
Do you have a preferred language?
English.
Is there anybody involved in your care at home?
Just my parents.
Okay, and have you been feeling any thoughts of self-harm or suicide lately?
No.
Okay, client appears to be stated age. They are not showing any signs of anxiety or nervousness. They're not, there's no tremors, they're not sweating, their clothes are clean, they are well groomed, the hair's cut short, no foul odors, no diaphoresis. Vince, could you please tell me where you are right now?
I'm at Arlington Village Hospital.
And could you please tell me what year it is?
It's 2019.
Okay. And the patient is oriented to person, place, and time. Already asked the name at the beginning. And they are awake, alert, and oriented ×3. And their speech patterns are regular, not too fast, not too slow, no stuttering or anything. And Vince, have you been having any problems with your senses lately, like your vision or your hearing?
No.
What about your sense of smell or taste?
No problems.
Okay. And I'm going to be inspecting your mouth now. So would you please open your mouth for me? Okay. I'm going to check your ears here, and your other ear. And could you lift your head back? Check your nostrils. And could you pull your bottom eyelids down just like this? Okay. Patient has no drainage from the eyes, nares, or ears. The inside of the mouth is pink. The oral mucosa is pink and moist. The teeth are consistent white color. And the sclera is white, conjunctiva is pink and moist. So Vince, could you please look between my eyes right here? I'm going to shine this in both of your pupils twice. Okay. And could you please look at this point on the wall over here? And when I say go, I want you to change your vision from that wall to the end of my pen. Okay? 1, 2, 3, go. Okay. Patient's pupils are equal, round, and reaction to light and accommodation. Now, Vince, we're going to make some funny faces. Could you please puff out your cheeks for me? Could you give me a big smile, a big frown, and raise your eyebrows? Okay. Patient has symmetrical facial movements, no drooping on either side. And Vince, we're going to test your grip strength. So could you please hold your hands out like this for me and give my fingers a good squeeze? Okay. Could you hold your hands out just like this and push up against my hands? All right. Could you do the same thing with your right leg and your left leg? Okay. Patient has bilateral equal grip strength and bilateral equal muscle strength on the upper and lower extremities. I'd call it a 5 out of 5. Now, Vince, have you been having a cough lately?
No.
Any problems breathing?
No.
Okay. I'm going to listen to your lungs right now. So I just want you to take a deep breath when I move this, okay? Go ahead. Okay. And one more time. Okay. Could you please sit up on the edge of this bed here? Again. 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 And last time. Okay, sit back down. Patient has normal breath sounds, auscultated in all points. No adventitious breath sounds, no crackles, rails, or wheezing. And when they breathe, their chest rises symmetrically, and the respirations are happening at a regular rate. Not too fast, not too slow. There's no use of accessory muscles either. So Vince, could you tell me if you've been having any chest pain lately?
No chest pain.
Okay. Do you ever feel any fatigue just doing daily activities?
No.
Do you ever feel your heart palpitating?
No.
And have you ever had any spells of fainting?
No.
And do you have any problems or any difficulties just going or doing daily tasks at home?
No problem.
No? Okay. So I'm going to be listening to your heart now. So I'm going to listen to 5 points on your chest. And just breathe regularly. This is your aortic. Okay. Your pulmonic. Your tricuspid. I'm sorry, your Erb's point. Tricuspid. And your mitral. Okay. Patient has normal S1 and S2 auscultated on all 5 points. No murmurs, no S3 or S4. And their heart rate's at a regular rate. Not too fast, not too slow. So before we move on, I wanted to ask you about your legs. Have you been having any pain in your legs when you exercise?
No.
Any tenderness at rest, like right now, in your calves?
No.
Okay. So could you please hold your hands out just like this for me? I'm going to assess your capillary refill. Okay, your capillary refill time is less than 2 seconds for all fingers. Could you keep your hands out for me? I'm going to palpate for the temperature of your skin while I'm up here. The temperature of the patient's skin is warm throughout, and their skin color is consistent and regular for their ethnicity. And last thing, Vince, I'm going to check your radial pulses. Okay. Patient's radial pulses are equal bilaterally, and they are +2. I'm going to do this for your toes now. Okay. Also, there's no clubbing on the patient's fingers, and there's no clubbing down here either, and the capillary refill time is less than 2 seconds for all toes. I'm going to palpate for edema. Okay, patient has no palpable edema, and their skin temperature is warm throughout. Their skin color is also consistent and regular for their ethnicity, and the hair is equally distributed. Now, Vince, I'm going to take your pedal pulses down here. And the patient's pedal pulses are +2, equal bilateral. And Vince, have you been having any nausea lately?
No.
Have you had any vomiting or diarrhea?
No.
Okay, and when was your last bowel movement?
It was this one.
How often do you have bowel movement?
I'd say twice a day.
Okay, and what would you say the color of it is?
Brown.
What would you say the color of your urine is?
It is yellow.
Okay, and do you know when you need to go?
Yes.
Okay, I'm going to be inspecting your abdomen now, so could you please pull up your shirt?
Okay.
I'm going to inspect in this area. And down here, patient has no ostomies, tubes, or drainage, or masses visible. Then I'm going to listen to the 4 quadrants on your abdomen right now. So your right lower, right upper, your left upper, and your left lower. Okay. Patient has regular bowel sounds auscultated at all 4 quadrants. Not too loud, not hypo or hyperactive. Vince, do you need to use the restroom?
No.
Okay. I'm going to be palpating over your stomach and for your bladder, and I'm going to be using Vince's hand because he's ticklish. So I'm going to palpate. Let me know if you feel any tenderness. Okay, I'm going to palpate the bladder now. Okay, the bladder could not be palpated, and I also could not palpate any masses or any areas of tenderness. He's shown that he's not feeling any pain. Yeah, no masses or tenderness. And bladder cannot be palpated. So Vince, could you please tell me, do you have, you can put your shirt back down. Have you had any skin disorders?
No.
Okay, and have you had any skin cancers?
No.
Okay, could you please turn over to your side? I'm gonna check for your bony prominences here. Okay, it's for any skin breakdown. Elbows, okay. Patient has no signs of skin breakdown anywhere on bony prominences or anywhere on the back side of the body. I've already checked for skin temperature. It's warm throughout the entire body, and skin color is consistent throughout the body, and it's also normal, regular for their ethnicity. Also, I forgot to mention that their umbilicus is midline. It's consistent color once again for their ethnicity, and it is soft but not tender. Let me push it back down. Now, Vince, I'm going to assess your skin turgor. I'm going to pinch you right here. Okay. There's no skin tenting and skin rebounds immediately. Now, Vince, I want to ask you, do you use any mobility devices to get around your house?
No.
Do you have a history of falls?
No.
Okay. And do you hold on to furniture when you're walking?
No.
Okay. And do you have any joint pain?
No.
Okay. Could you please come sit on the edge of the bed? Let me do some motions. Could you please raise your hands behind your head, behind your back, up in the air, Superman. And could you raise your right leg out, back down, left leg out, back down, both up, and toes out, and toes back towards you. Patient has full range of motion and all joints tested, and that completes my assessment. Vince, thank you very much. Have a good day.